Good evening to all. My name is Leslie Weir, and I'm the Librarian and Archivist of Canada. Thank you for inviting me to speak this evening. Before I begin, I would like to recognize that I'm speaking to you from the traditional, unceded territory of the Anishinaabe people. Most of us live and work on various Indigenous territories. I would therefore invite you to take a moment to recognize the territories on which you are right now. I'm very happy to be associated with the University of Ottawa Press to hold this event. Technology helps us to take advantage of those times when we are physically isolated. We have been going through a very difficult period for a number of months on a worldwide scale. At Library and Archives Canada, as has been the case everywhere else, we have had to adapt to the radical changes that COVID-19 has ushered into our personal and professional lives, all the while as our universe was transformed overnight by physical distancing, isolation, and remote work. But despite all the difficulties the pandemic has created, it has also created opportunities for us to join forces and to rethink our methods of work. Our role at LAC is vital in building our collective memory in order to help tomorrow's generations to understand what we have experienced through this period and how society has changed following this planetary event. I'm sure that we're all eager to know more about the book Vulnerable and to find out more about the inspiration of their authors. And I would conclude by thanking all those who have made this conference possible for their efforts. Without further ado, I will now yield the floor to our moderator, Philippe Marcoux. Thank you, Leslie, and welcome to this webinar that will deal with some of the issues raised in this book, Vulnerable, the Law, Policy, and Ethics of COVID-19. I say some of the issues because this is a really exceptional book we're talking about that canvasses what I would call the gray areas in our collective response and especially our government's response to the health crisis triggered by COVID-19. I say it's an exceptional book because not only is it hugely informative about the current crisis, but also it's exceptional because it's being published even as we are in the midst of the crisis and highlights a number of the failures of our system, and that this is incredibly relevant. And today, we will be focusing on some of those who have fallen through the cracks of our responses. And we'll be hearing from three experts who authored chapters in this book, whom I'll introduce in a moment. And they will each make a presentation, and then we will have a joint discussion about the issues that are common to their research. So, I am very happy to greet Sophie Thériault, Martine Lagacé, and Catherine Lippel. Thank you very much for being here. So, Sophie Thériault, let's start with you. Sophie Thériault is a professor and vice dean of studies at the Civil Law section at the University of Ottawa Faculty of Law. Her research focuses on the rights of Indigenous peoples in the context of natural resource extraction, environmental governance by Indigenous peoples, environmental justice and rights, and Indigenous peoples' food security and sovereignty. And she was a co-author of a chapter in Vulnerable on systemic discrimination in government programs and services against First Nations during the pandemic. She was also responsible for the section in the book that focuses on equity in the response to the health crisis. Sophie Thériault. Thank you very much, Philippe Marcoux. I'm very pleased to be with you today. I'm speaking to you from the traditional and unceded territory of the Anishinaabe Nation. So, the COVID-19 pandemic and the measures taken by the government in order to fight it have directly or indirectly affected practically all of the world's population. However, despite the many slogans of solidarity that have flourished over the past few months, we are not equal before the virus, nor when it comes to public health measures taken to stop its spread. So, even though no one is completely protected from COVID-19, some people and some groups are disproportionately exposed to the virus and for reasons that are largely beyond their control. For example, COVID-19 spread quickly within institutions where people are confined and have little control over their surroundings, and where it's also very difficult for them to take precautions against the virus. I'm talking about long-term care homes. I'm talking about group homes for severely people with severe disabilities. I'm talking about psychiatric hospitals, and I'm talking about prisons. So Professor Lagacé will be talking at greater length about the tragedy that has unfolded in long-term care homes, where 75% of deaths in Canada have taken place. I will focus on the inherent vulnerability of elderly people to COVID-19, the chronic shortages of staff within long-term care homes, the insufficient remuneration and lack of job security of staff, and also the several years of budget cuts that have created an insufficient level of supervision, and that has created an environment that is that lends itself very much to outbreaks. And the Honourable Jane Philpott has written a chapter which shows that the same issues are existent in other kinds of care homes in Canada. In Canada, just like elsewhere in the world, especially in the United States, a number of outbreaks have taken place in prisons, exposing both staff and inmates to COVID-19. So, in spite of the risks created by the pandemic, and Professor Yves Tenet addresses this in Vulnerable, a number of correctional institutions have refused to adopt adequate precautions, especially by not canceling group activities, by not providing personal protective equipment that would have been required. And in addition, in some correctional institutions, ironically, there has been an increased rate of solitary confinement, a measure that has been decried for years because of its effects on both human rights and mental health of inmates. So given the overrepresentation of Indigenous people, racialized individuals, people living with mental health issues, and people in situations of poverty in prisons, the management of the pandemic within those institutions has resulted in an exacerbation of the disadvantages experienced by the most marginalized of the society. A number of those individuals, while not strictly speaking confined in care homes or correctional institutions, have limited control over their social, economic, and environmental conditions, and are therefore also particularly vulnerable to COVID-19. In urban centers where access to affordable housing is ever scarcer, where individuals experiencing poverty with an overrepresentation of women, racialized individuals, and recent immigrants, such people are often forced to share overcrowded and often badly ventilated housing, which prevents members of a family to protect themselves in case of an infection. Ironically, these same individuals tend to hold jobs that are precarious but deemed essential, that expose them disproportionately to the virus. I'm referring particularly to first-line staff, personal support workers, janitorial staff, and employees in meat processing plants and slaughterhouses. So, as an illustration, in the Greater Montreal area, 80% of personal support workers in long-term care homes are racialized women, especially Black or North African women. The vast majority of staff in meatpacking plants, where, as we know, there have been many outbreaks, are racialized individuals, new immigrants, and temporary foreign workers. The data recently collected in a number of urban centers in Canada, especially Toronto, Montreal, and Ottawa, showed that there has been a disproportionate toll of COVID-19 within the Black population, and this situation is attributable not to individual decisions or excessive risk-taking, but rather to the nature of jobs held by these communities and their living conditions, especially in terms of housing and transit. Finally, Indigenous communities that have been largely spared during the first wave but are now experiencing a vertiginous and extremely concerning rise of COVID within their communities are in a particularly difficult situation in the context of the pandemic, given the systemic inequalities they have to deal with in terms of housing, access to potable water, and access to adequate health services on site or close to their communities. The recent death of Joyce Echaquan, a member of the Atikamekw community, amidst the racist taunts of the Joliet Hospital staff, as well as the recent evacuation of a First Nation in Northern Ontario because of the contamination of their only source of drinking water. Those are examples of the issues that the pandemic has created for these Indigenous communities. I would also refer, because this is very recent, I would also mention that the Shamatawa community, that is a community located in northern Manitoba, about 750 kilometers north of Winnipeg, is currently dealing with a double outbreak of COVID-19 and tuberculosis. So, to conclude this canvas of the tragic effects of COVID-19 on the most vulnerable groups and individuals within our society, vulnerable both to the virus and vulnerable to the measures taken by governments, those effects are in fact the outcome, the highly predictable outcome of public policy and austerity measures that have been taken for a number of years in a number of sectors such as elder care, access to housing, the struggle against poverty and racism, decolonization and respect for Indigenous rights, and the protection of the most vulnerable workers. A just and safe post-pandemic future for all requires structural change to remedy the deep structural inequities that have caused this tragedy, while promoting health and welfare for all, while recognizing our close interdependency. Thank you very much, Sophie Thériault. Martine Lagacé is a professor in the Department of Communication, member of the Life Research Institute, and Associate Vice President for Development and Research Promotion of the University of Ottawa. She researches interpersonal communication, ageism and identity, and she is the co-author of a chapter in Vulnérable entitled COVID-19 and Ageism, a Foreseen Crisis in Long-Term Care Homes. Martine Lagacé. Thank you very much, Philippe Marcoux. I would like to thank my colleagues from Library and Archives Canada that have made this conversation possible that we're having today, as well as the Presse de l'Université d'Ottawa that have published Vulnérable. So, my colleague Sophie Thériault was mentioning that a number of things have changed during this pandemic. Others have not changed, unfortunately. But now we have a little more perspective, and this second wave is an opportunity to take stock of what's happened and to think about potential solutions. So I won't be the first to note that this pandemic has brought out situations of inequity. In fact, has amplified such situations, as Professor Thériault was saying. Those are issues of inequity that have existed for a long time, and that will be my purpose today, to demonstrate what is happening, what has happened in long-term care homes, that this was predictable for decades. So this pandemic crisis plays the role of a magnifying glass to show us that we have a lot to do, especially in terms of aging. I think that this has highlighted the importance of the social determinants of aging. As never before, we have become aware of the isolation and loneliness of elders, which is a well-known fact to researchers, but that the pandemic has really brought out. So my colleagues and co-authors in this chapter and I have focused on long-term care homes, and we're asking in this chapter, was this crisis not foreseen and foreseeable, and how have we responded, and that has been an improvised response to that crisis. So our purpose is broader than long-term care homes. We wrote that chapter as a call to rethink aging, to rethink the place of the elderly within society, to recenter aging within society and not on the margins, as is unfortunately the case in a number of long-term care homes. So our chapter is a call for a paradigm change. It may be ambitious, but a paradigm change in terms of our very Western or North American way of thinking about aging. We are very critical, but this is criticism to the government and also criticism of ourselves as citizens. How do we want to age together? How do we age together? How do we live with the elderly, and how can we reimagine aging? So why do we focus on long-term care homes? Well, to ask the question is to answer it. Long-term care homes have been in this first wave of the pandemic the most revealing symptom of our very problematic rapport to aging, to the place of the elderly, especially the more fragile elderly. So just to step back a little bit, and this is what we try to show in the chapter, to show that what happened once again far upstream of the pandemic went unnoticed. And so why have reports and calls to action about issues in long-term care homes in Quebec and Ontario and in other provinces went unheeded? How did that happen? So about 75% of deaths during the pandemic occurred in long-term care homes, especially in Quebec and Ontario. In Quebec, it's almost 10% of people in long-term care homes have in fact died. So it's a whole generation, and then the next wave will be just as problematic. But it's been over 10 years, almost 20 years, since we've had Royal Commission reports on long-term care homes in Quebec and Ontario, since we have had reports documenting serious issues. Some long-term care homes are in inadequate and outdated buildings. I'm talking about air quality, ventilation, inspections to check on the quality of life in those institutions, wax and wane depending on the government in power. Inspection plans for long-term care homes exhibit a lot of disparities. There is a chronic lack of human resources, chronic shortage of human resources, issues of remuneration, and I would also add, since my colleagues and I have done a lot of work talking to residents of long-term care homes, many times we went to them to hear their voices, even though it's often difficult because residents are afraid of reprisals. We very often heard them say that they don't feel they are in a living environment. They feel that they are in an environment that looks and feels more like a hospital than anything else. So that is what we were documenting, and there was many reports documented that are now probably gathering dust, and governments ignored those reports, turned a deaf ear. And when the pandemic happened in March 2020, long-term care homes were at the margins of government public policy, and they were already helpless to address the pandemic. And so the question we ask in this chapter: has government neglected? Has government been negligent by ignoring previous concerns? And that brings the issue of discrimination. But so those reports, those reports that were ignored, came decades ago. But a few months into the pandemic, and that is problematic, we did have data from the World Health Organization in December 2019, in January 2020, in February 2020. We had data from the WHO that showed that European countries, especially Italy and France and Belgium, that had been cruelly struck by the virus, we knew that the combination of age plus comorbidities, so the combination of being elderly and having underlying conditions, health conditions, was the most dangerous equation when confronted with the virus. And that is the profile of many, many long-term care home residents. Those are very old people who have a number of comorbidities. So we can ask why, in preparing, in planning for a response to the virus, knowing this, having this WHO data, having the experience from colleagues in Europe, why did provinces not make plans for infection control, plans for systematic tracing, systematic testing for residents, for caregivers? Why have a EPI of sufficient quality and quantity? Why has travel from one home to another not been limited? And as we know, none of that was done. The Canadian forces had to be brought in, and they made a report, that a catastrophic report about long-term care homes. And after 6 weeks of crisis, in which long-term care homes were very, very, very badly struck, provincial governments and the federal government said, well, the elders are now a priority. They became a priority when the situation had become almost unmanageable. And so we are asking in our book, this negligence faced with issues that have been known for at least 10 years, and during the few months preceding the crisis, and then followed by another form of negligence because the WHO data were known. Is this a form of ageism? Is this a form of indifference to some social groups, such as especially the elderly? So what is ageism? Ageism is age-based discrimination based on stereotyped and negative beliefs about elderly people. In our Western culture, we have a very ambiguous approach to aging. Aging is mostly associated with decline, with economic problems and health economics, especially problems. So there's abundant literature about that. People 60 and over are described based on frailty, on dependency, and what is even more eloquent is that those stereotypes are especially prevalent in the way people the very elderly, 80 and above, are described. So ageism is translated into discriminatory practices, negligence, and indifference. The consequences of ageism are abundantly documented in terms of mental health of those who are discriminated against. If today we are talking about long-term care homes, it's because they are the tip of the iceberg of the manifestations of ageism. But ageism is prevalent in many, many other social spheres. Older workers are also the target of age-based discrimination by employers. But, and I'll conclude on this, but ageism remains a very little known form of discrimination, and very little has yet been done to fight ageism in a context where we talk about diversity and inclusion. I think it is past time for the issue of ageism to be truly addressed, the way it is manifested and its consequences. Of course, it's hard to say, well, we will change the situation of long-term care homes and fight ageism, but I think that one of the first things to do in the short term is to rethink what it means to grow old with health frailties, to rethink what long-term care homes are about, to transform them into smaller, more inclusive structures where residents can continue to be part of society and not be relegated to the margins. In short term, that is what we recommend. In the long term, I believe that all of us as citizens must ask ourselves, how do we want to age, together or separately on the margins? And that means we have to rethink once again the paradigms related to aging. Thank you. Thank you, Martine Lagacé. Catherine Nippel is a professor in the civil law section of the University of Ottawa Faculty of Law, and she is a research chair in health law and labor security. She researches workplace compensation and return to work after an accident, especially during the pandemic. And her question is, what are the priority rights in a pandemic? Thank you, Philippe Marcoux, and thank you to my colleagues for inviting me to take part in this discussion. There are a lot of overlapping issues. I listened to my two colleagues, and it's very interesting to see that the issues of negligence are very present. The main question that our chapter posed in the book is the effectiveness of health and job tenure laws in Quebec and elsewhere in Canada. Our laws designed to protect workers, but did they do the job? Did they work? And unfortunately, during the first wave, we found that sadly the answer was no. And having worked continuously on the issue since then, I can tell you that unfortunately things have not improved since the first wave. So, is this a problem with our laws? Are there gaps in health and safety laws? And what we found was that it wasn't so much that there were gaps or that the law didn't provide for adequate protection, but rather that the law was not applied. And in a striking way. Some examples. The Quebec Public Health Institute published a study in the fall dealing with the first wave, and that study shows that over 13,000 health workers had contracted the virus. In October and November, now we have 17,000. The rate is 10 times greater than the general population. And well, people are saying, well, it's obviously they're health workers. But in Australia, it's 2.6 times the rate in the general population, whereas in Quebec, it's 10 times greater among health professionals. The Quebec Public Health Institute surveyed health workers, a large sample of over 5,000 respondents, of health workers who acquired COVID-19 during the first wave. Over 40% did not have access to PPE, and over 40% did not get training. And so this is scandalous when we know that those provisions are in the law. My law students say, but it's in the law, so why wasn't it applied? Well, that's not the way it works. So if you take a closer look at why did people not get PPE, and thanks to the media during the first wave, and this is reflected in the chapter that we wrote, we were able to understand why equipment was not provided. And we're talking, for example, about masks, N95 masks, so medical masks, procedure masks. And we're also talking about footwear, about gowns. Our premier has pointed out that there were a lot of things that were lacking at the beginning of the pandemic. So why was PPE lacking? And when there's a shortage, who gets it? Who gets what's available? So what we found in both Quebec and Ontario is that in 2004, reports written by commissions of inquiry. In Ontario, it was the Campbell Commission. In Quebec, it was the Ministry of Health and Social Services. Reports that showed that the SARS epidemic had revealed that our society was not equipped to protect our first-line workers and especially health workers. And there had been a series of recommendations in both provinces. In 2004, and those reports were published by the governments themselves. And what we saw with the COVID-19 pandemic was that they didn't follow their own advice. For example, if you were to take masks, we discovered, thanks to the media, that masks were either non-existent or expired. There were cases where masks had been expired for 10 years. So both commissions of inquiry, and also at the federal level, there were other commissions, other studies, concluded that we had to have large numbers of masks in reserve, and that was never done. It was done at the beginning, but those masks were allowed to expire and not replaced. And for me, it's clear that, well, either it's a matter of total disorganization that is problematic, or it's a context of austerity that led to the decision of, okay, either we get one extra nurse, or two extra PSWs, or we replace the masks. We can't afford to do everything. And staff comes first. And so whether it be in long-term care homes, whether it be in hospitals, we are short of staff, and that is what creates a number of crises, and we also documented that in our chapter. At one point, doors were locked so that people couldn't leave. They had to do 2 successive shifts. They had children at home, but the doors were locked so that they couldn't leave. Social workers at one point were forced to work without training as PSWs or face firing. Workers, sometimes unionized workers, were treated neither according to the law nor according to their collective agreements for reasons that were understandable during the first wave, because we were in such a crisis as a society. People were dying in long-term care homes for lack of staff. There's one inquiry in progress in the Heron long-term care home. At least 39 people died in that home, and at least 5 from COVID-19. And the coroner is assessing to what extent the other deaths were related to to negligence, absence, a lack of care because of lack of staff. So the organization of work, the least that can be said is that the organization of work was not up to the demands of the pandemic through a lack of preparation. So for the second wave, are we in the same situation? Because the second wave, we could see it coming. It couldn't be said that in April, May, June, when we discovered the importance of prioritizing the elderly, we knew there'd be a second wave. So what we have just the research we've just concluded. I've just finished writing another paper, especially in terms of the effectiveness of the law in Quebec. Nurses unions, other unions have gone to court for the right to wear N95 masks, because right now there's still an order in council that says that health workers are not permitted to wear such masks unless they are performing procedures that, okay, without going into technicalities, that create droplets. So for intubation, you put on an N95 mask, but a paramedic taking care of a patient without intubation, so those are procedure masks that should be worn. And that order has been enforced since June 8th. A number of unions have gone to court. In fact, those procedures have been pending, those court processes have been pending for months, and the hearing should be in the fall. Okay, we could have ordered other N95 masks. Okay, ours had been expired when we forgot that 20 years ago that there were 2 reports. Now we remember those. So when in doubt, in a context where we should be focusing on the precautionary principle, all I can say is that the necessary masks were not ordered that could have eliminated the danger at source. And we have 17,000 health workers that contracted COVID. We can't say that the first wave went well. We can't say that we didn't really need a N95 mask, that the 40% of people who didn't have their masks wasn't a real problem. Studies show that workers, both in Quebec and in Ontario, especially in Ontario, that workers, and this was actually there was even a Canada-wide study, those who did not have PPE were more liable to have mental health problems associated with the first wave. And that is true not just for health workers. I don't want to forget other first-line workers. This also applies to those who work in grocery stores, those who work in slaughterhouses, in meat processing, those who are deemed essential, and those are people to whom essential protective equipment was not provided. So, faced with all that, the only conclusion I can draw is that the austerity dynamic upstream of the pandemic predetermined what we experienced. And without wanting to be pessimistic, I fear that we're in a recession, of course, because of COVID, and I fear that we will be experiencing difficult periods in the name of austerity, and that austerity will keep exposing first-line workers to inadequate protection measures. I'll stop there, and I'd be happy to take part in this conversation. Thank you very much, Catherine Lippel. So thank you to all three of you. What you say is fascinating, also concerning, because each of you identifies forms of discrimination that were exacerbated by the COVID-19 crisis, but in each case that were pre-existent and notoriously so, blatantly so. Is it not unavoidable that authorities decide to focus first on, the most decide not to deal with minority groups, marginal groups, groups that are already being discriminated against? Is this not the system that makes it so? I can open the discussion, and this may be a little provocative, but are workers a minority where there is a juxtaposition? And I'm referring to Sophie Thériault's presentation. The people that I'm referring to who contracted COVID-19 while they were working in long-term care homes or hospitals, those people were racialized people in the majority, as Sophie Thériault has said. So is it normal that in order to reduce costs, that we reduce remuneration in public services. This has an effect on minority communities, or those who receive services for the other, and those who provide such services in precarious situations, in situations of insecurity. So, okay, I don't think there was a decision to cast aside minority groups. It's just that people who care for the elderly are racialized. Social services are provided by racialized people. And of course, um, uh, often people who receive the services are people living with disabilities or from minority groups. But since at least 1995, there have been cutbacks to public services by saying that we have to cut back on the deficit, and we have to cut back on everything that makes us uncompetitive as a society. And there's a direct line from that. And it's not at the expense of minorities, it's at the expense of the quality of public services. Okay, that's my opening gambit. So I'd love to hear my colleagues. Yes, I would add that inequality and discrimination are not preordained. They are the result of public policy, of social choices that are not unavoidable. So rather than asking, well, should governments focus on minorities, quote unquote minorities, in a crisis setting, I think the real question is, how can we upstream, how can we fight against inequalities, how can we fight against discrimination that would result in increased vulnerabilities if a crisis hits? So those vulnerabilities are avoidable. Those vulnerabilities don't need to exist to the extent that we have just societies. And in terms of the term minority, majority, just as Kathleen LeBel pointed out, are we really talking about a minority? Can we say that elderly people are a minority? Women are not a minority either. So amongst the most vulnerable, a lot of people are labeled as minorities, but this juxtaposition between the majority and minorities tends to obscure the interdependency of people who don't live in silos. So the inequities that are prevalent in our societies increase the vulnerability of people who are at the receiving end, but increase our collective vulnerability. So a society that would be safe for all is a society that would also be more equitable. So the distinction between the majority and minorities should not obscure the fact that we're all interdependent and that respecting the rights of some promotes respect for the rights of all. Yes, okay, maybe it's the cynical journalist talking here, but I was imagining the government's response and actually the government has invested a lot of money. They did try to do a lot. If you look at the economic reports we've been getting, but despite that, we didn't manage to attack the root of the problem. So hence the dichotomy between majority and minority. Perhaps the terms are inappropriate, but some people did were helped during the crisis, but not the groups that you've identified. Yes, I just want to add to what my colleagues have said in the same vein. For decades, we have been constructing vulnerability. We have been constructing the situation of inequity in which a lot of elderly people are today. What's happening in long-term care homes could have been avoidable to some extent, and sometimes even their health conditions could have been avoidable. But upstream, when you're 50, 60 years old, how you experience aging and what do you prepare for and what is being imposed on young people, um, all those factors are constructing our vulnerability later when we become elderly. And I understand, Sophie, what you're talking about, majority and minority, but chronologically, um, there are more people who are 65 and over than people who are 14 and under. So we are a majority. And aging is cross-cutting in society. It's our future. So let us build that future that is based on a much healthier relationship between young and old. So, okay, let's dwell on that, but maybe with a more, maybe from a more positive angle. So what would it look like? What would it look like if we had a more fairer response to this exceptional crisis? For each of you, in each of your areas of research, or overall, because as you say, there's important overlaps. Okay, maybe I'll respond on the spot because there are positive elements. It's important to stress that. Where in the second wave, I was very, very comforted to see that governments had listened and understood that the question of the social good, regardless of age, whether you're be 8 or 20 or 90 years old, is essential. And in the second wave, at least in Quebec and in Ontario, maybe in other provinces, but in my experience, caregivers were allowed to continue maintaining a link with the long-term care home residents. I don't know about what will happen at Christmas, but there was listening and greater focus on the mental health of elders. And to me, that shows that governments understand that aging is a physical process, but there are social determinants as well, and that social bonds must be preserved even in a crisis. And I think we've managed that much better in the second wave. So I would add that you have pointed out fairly, that accurately, that governments have been spending a lot of money since the beginning of the pandemic to address the immediate urgent needs of many members of society. That's essential. We're in a time of crisis, but nonetheless, this is dealing with the symptoms. To me, a truly sustainable solution to the pandemic would be for governments to dwell on the structural causes, the institutional causes of the injustice experienced by a number of groups within our society. So recognizing the systemic nature of discrimination experienced by a number of groups that are made vulnerable within the COVID context of COVID, that would be a beginning, and then make the deep structural changes that are required to remedy over the long term, to remedy the problem. Otherwise, the next crisis, we will still have the same litany of problems that will still affect the same groups of people. And once again, we can treat the symptoms until the crisis passes, and then just forget until the following crisis, forget those groups. So focusing on the problem at the structural level is essential. And we see it with the First Nations. We have a whole panoply of reports, of royal commissions. For example, the Royal Commission on Indigenous Peoples in the 90s, the Commission on Truth and Reconciliation, the investigation on murdered Indigenous women, the Vien Commission in Quebec, that have highlighted the same problems with many, many solutions being proposed. So we can't say we don't have the solutions there, but now we have to make them a priority. So we have to make a social choice, a public policy choice to be better prepared for the next crisis. If I might add, in terms of workers, in Quebec at least, there has been recognition of personal service workers as being a key link in the proper functioning of institutions, and it's as though they had been forgotten. So Premier Legault has organized the hiring and training of 10,000 personal support workers, and maybe this will resolve the labor shortage problem in the short term. But if you look at their working conditions of nurses who have in large numbers deserted salaried positions in the public service to work for temp agencies, because that was the only way to control their schedule and not be forced to do double shifts. So as long as we don't make an effort to improve the working conditions for people who work in the public sector, or even in the private sector, I'm talking about meat packing plants, we will have temp agencies, we will have staff turnover, and we will have lack of job tenure, which means that when there's a pandemic, people quit because they don't have to be there because they don't have a permanent contract. So this so it's a shame, as someone said, to it's a terrible thing to waste a crisis. At least to learn lessons and focus on systemic problems. But I, I'd like to focus on your question, Professor LeBel, in the title of your chapter in Vulnerable. You ask what rights take precedence in a pandemic. So I don't want to put you on the spot, nor to pit you once against another. But at some point, the government has to, you know, deal with a number of different sets of problems. Some are overlapping. Where do you start? Where do you start when you try to address those systemic issues? I might perhaps start. My title in English isn't exactly the same, and it's interesting. And I had objected, but I was stuck with the title in English. The title asks, in a situation like that, whose rights come first? Because in my chapter, focusing on working conditions, everybody has the same right to PPE. So who will actually get the equipment? Is it the doctor rather than the nurse rather than the PSW, or the PSW rather than the temp worker? So one of my findings was that those who had a professional governing body or a union behind them had a better chance to be heard than those who were working for a temp agency. And there was people who were working in untenured situations, very precarious situations, were seen when they died. That's when the media took notice of them. So that doesn't answer your question about whose rights are a priority. But if we're talking about elderly people, if people who take care of elderly people are dying, of course, the people they care for will not fare well. So we shouldn't have a law that only kicks in when someone shouts very loudly and embarrasses the powers that be in the media. Everyone should have equipment. Temp workers should have personal protective equipment, not just doctors. And even doctors have trouble getting PPE, but at least they can articulate, they can shout, they can get an article published in the Journal de Montréal. Right. Well, as it's a squeaky wheel that gets the grease. So the idea is not to give priority to the loudest groups, but at some point we have to decide what group gets the priority. I don't know, Professor Thériault, you've listed the groups in Vulnerable. There's many groups, so of course any society must avoid discrimination, but where do you start? I think creating a hierarchy of rights ahead of time is problematic because we know that discriminations are intersectional. We can't isolate grounds of discrimination and factors of discrimination. For example, black women in some communities of untenured work, the fact that they are a woman, the fact that they are racialized, the fact that they are a worker in a specific industry that is marked by a lack of tenure. So it's very hard to isolate specific grounds of discrimination separately. I think that the values and principles that underlie human rights, okay, that's not my research area, the fundamental human rights, but I'm thinking of key values that should be the basis for decisions, public policy decisions. So cardinal values such as dignity, human dignity. A cardinal value, somebody recently was talking about equality. Equality is the basis, the plinth on which rests the Constitution. So when we're talking about choices to be made on the ground, but before, upstream from those choices, as a society, can the government, and the government as in a crisis, can take extraordinary measures on a temporary basis. So in outside of a situation of crisis, would we not be able to give priority to the needs of marginalized people and groups without necessarily robbing Peter to pay Paul? So it's not a zero-sum game for me. It's a question of social choices and priorities set by governments. If I might add very quickly, and I too, I agree that it's difficult to give priority to one group over another, but I think I'm just about to do that. We're starting so far back dealing with ageism. It's a form of discrimination that's almost off the radar of discrimination. And Professor LeBel was saying we have to start by giving these people a voice. We talk about mental health right now. There are a lot of people who are suffering through that crisis, who have developed mental health issues, but there's very, very little heard from people in long-term care homes about their own mental health. When the survey is administered, they are not even surveyed, even though horrible things have been described during the pandemic. So, to me, the need to at least place ageism on the radar, I think that would be a start and a huge progress. And once again, we're all aging. We're all getting older, and it affects us all. And it's a part of an intersectionality, being a woman, being black, being elderly. Unfortunately, it's a lethal combination, and we will all get old. Well, Professor Lagacé, putting things on the radar, I think there are many things that in this book, Vulnerable, that you put on the radar. Many areas for reflection, several of which you've identified in your presentations. If I might be allowed to summarize and perhaps conclude on a somewhat positive note, you have highlighted that there have been huge challenges, especially in terms of equity in a time of crisis, but those challenges are not insurmountable. There are solutions, and in a number of cases, those solutions are known. Now we need the will to address those problems and put in place some solutions. Those solutions, it will take political will, it will take public opinion, but it is possible for those forms of discrimination not to be inevitable. So thank you, all three of you, for this extremely interesting conversation. And so have a look at Vulnerable. It is a book chock full of interesting lessons in this crisis. Thank you once again, Sophie Thériault, Martine Lagacé, Catherine Lippel.